End the stigma. That's the long-standing battle cry of mental health advocates as the number of persons experiencing mental illness continues to grow. Good thing there are organizations out there aiming to provide easier and affordable access to mental health experts. Mind You is one of them, and actress Yassi Pressman is joining its cause. And I got to speak with Yassi, and she told me what inspired her to be part of Mind You.
So last year po, March 2021, I was able to join Mind You. I was the first female investor actually. So happy Women's Month, everybody. I was very inspired by my friend Michael Needham. I was actually at their salons randomly and I was like, how are you? And then he's like, I'm good, yes, I've been busy, ganyan. Then he busted out his laptop and then he showed me his pitch deck and I was like, oh, this is very interesting. Wait, about mental health? And sabi ko, people don't talk about this almost at all. And he was like, exactly. And in 2018, the mental health bill was passed by Ms. Risa Hontiveros. That meant that any company with over 100 employees are mandatory na po dapat na meron na silang ganitong mga purpose, mga services for their employees, which is great because I feel like some people find it very expensive. So Mind You gives it an opportunity to make it more accessible to people and to make it more affordable to people. And I was like, okay, give me a couple of days to think about it. He says, perfect, yes. I only have a couple of days before I close this round. And within the week po, I came in and I went into the office and I said, I want to do this for the Filipinos.
Okay, so you mentioned something about accessible and affordable. I mean, what exactly is the goal of Mind You, and what are your thoughts also on the current mental health landscape here in the country? Where are we now? I mean, have we greatly improved from the past years, maybe 2 or 3 years ago, especially pre-pandemic? Where are we now in that?
Actually, Miss Christine, we have not improved. It has been very bad for a lot of us. The numbers have been inclining and I guess hindi mo rin mabiblame po yung mga tao kasi ang hirap po talaga ng pinagdaanan natin from the virus, the pandemic really shut everyone's businesses down. That meant they're not making money for their family. That meant they're losing their jobs. That meant they were losing hope as well to where the future will bring them. So, hindi mo rin po masisisi yung mga tao kapag ang bigat-bigat ng nararamdaman nila. And I just feel very, very sad when I see all of the numbers because it's not just about feeling sad and the people who are hit by depression, but it's also the people who are also committing suicide. And it's very, very difficult to talk about, but we have to start because once we end the stigma, then ito po mga tao, they feel that they're voiceless, they can actually be heard and they can start a conversation and people can help them. Well, Mind You wants to be able to help at least 1 million Filipinos in the next 5 years. And hopefully po, because we're doing a lot of B2B, we will use some of that budget to be able to provide to 100,000 Filipinos free services naman po when we open out to the public. So that's a beautiful, beautiful thing. Currently, we have so many clients on board. We want to say thank you because we have almost 45,000 people who are with us right now. And we have big clients, like thank you to Ayala, GCash, a lot of people that I won't say their names na lahat, pero thank you for trusting us. And thank you for giving your employees this type of opportunity. That means you truly care, and that means so much.
And speaking of numbers, yes, like you mentioned, the mental health billion that you have to have these services to corporations exceeding about 100 employees. With that number, 100 employees, what type of services do you have, knowing that these people vary in terms of their mental state? How do you address that in one lump?
So, Ms. Christine, we do have a platform. It's our website. And when you go onto our website, you'll fill up a survey that's going to get to know you. So that will gauge anong level po kayo. So what type of help you're going to need. If it's a regular weekly thing or if it's something that's very, very important, it has to be addressed right now. You'll be given a list of more senior psychologists, and they will meet you more than just once a week. And then we'll also have another level po, which is very, very urgent, which who will meet you like almost every day if you need. And the only thing about that is that you just have to schedule. We have a list of available time slots. We have a list of available psychologists, and the survey will really help us get to know you and your needs.
Okay, and you come from a place of experience. I mean, you actually went through something that affected your mental health. I know it might be a little bit personal, but how did you deal with it, and how difficult was it? You know, for somebody like you, I mean, you're so popular and everybody knows you, but how difficult was it to discuss what you were going through?
It took me a long time, po, Miss Christine, because I always thought before that being vulnerable is a sign of weakness, but it isn't. Now I know that it's a sign of strength, because the people that come to you after that say, yes, nakarelate ako doon. Thank you so much for telling your story, because now I feel like I'm not alone. That gives me strength and that makes me stronger. And so for me po, I guess I started working at 6 years old. Most people didn't know this. I've always believed na kaya ko until maybe 2016, when I started having mini anxiety attacks, and I didn't know what it was. I didn't know how to deal with it. I didn't even know what an anxiety attack was, right? Then it escalated po when I lost my father. And then everything just kind of, I had a mush mind, basically. I didn't know how to deal with myself. I didn't know what to do. And the attacks just got stronger and stronger. And I said this in the podcast that Liza is hoping, an open mind with Liza Sobrano, that is powered also by Mind You. I said, one of my attacks, I felt like I was having a stroke, where I couldn't feel my legs, I couldn't feel my chest, almost my arms, my hands were freezing, and I couldn't move. And like even till now, po, if I talk about it, I start shaking, because I'm so new to be. Parang sobrang bago po sa akin na pag-usapan po lahat to, but I do feel like it needs to be heard. And advice that was given to me was breathe, of course, tap your legs, make you feel alive physically, and then that's gonna send signals into your brain to tell you to relax as well. And that helps. And I wouldn't have known that if I didn't talk about it.
It is Women's Month. So with that, what is your message to women out there who might be struggling with their mental health?
Just listen to yourself. I think pinaka-importante is that you're honest to yourself. Denial is, I guess, a part of everybody's lives, right? But to really process and to feel, for me, that helped me when I actually didn't just band-aid the wounds, when I actually saw the wound, open it up, and saw there was glass inside. And then I pulled out the glass, then I sewed the wound closed. That's how I think about it. And alam ko po na everybody has a different situation, right? But that's my advice. Just be honest, listen to yourself, feel it. It's okay to feel it. It's okay to cry. Because one day you're going to be okay. You're going to be better.
Thank you so much, Yassi, for joining us this morning.
Thank
Right
you.
here on Your Day. And, all the best to you, and, more power.